My name is Carson Knight. I am a member of our board of directors here at the Bleeding Disorders Council of California, and I'm going to be your moderator tonight. We are joined by Michelle Rice, who is our wonderful expert on all of the changes that have been happening in the healthcare space, which is why you are here. But before we get going, wanted to say a big thank you to our sponsors that made putting on this webinar for you tonight possible. Our premier sponsor, Takeda, also for helping us with our Spanish translation. Some of our excellent sponsors, Sanofi and Genentech, our bronze sponsors, Hemophilia Alliance, Novo Nordisk, and Pfizer. And our contributing sponsor, the National Bleeding Disorders Foundation, and our partner at Bayer. Okay, so bit of background for folks that don't know about us. You are here tonight, so I hope you know a little bit, but we are the Bleeding Disorders Council of California. You might know us a little bit better as the Hemophilia Council of California. We've done a bit of a name change. We have been around for decades now, based in California. And we handle the advocacy agenda of all of our four bleeding disorders and hemophilia organizations in the state. All of your local chapters in San Diego, Southern California, Central California, and Northern California. So we really coordinate our statewide access. So folks who are having issues getting access to their medication or coverage, which is really a subject for tonight. And we help with advocacy and access up in the state capital as well for all issues relating to folks with rare bleeding disorders. So that's just a little bit of background about the Bleeding Disorders Council of California. So with that, I'm going to go ahead and mute myself, and I'm going to turn it over to Michelle. Again, if you have any questions, please feel free to send them in the chat so that we can answer them throughout the presentation. With that, I will turn it over to you, Michelle.
I said, my name is Michelle Rice. Welcome. I think that some of you may have heard me speak before. I have spoken before for the council, and I also am a member of the community. I have two children with hemophilia, and I have hemophilia myself, and used to work for the National Bleeding Disorders Foundation. But now I have my own company, Michelle Rice and Associates, and we are a patient advocacy and kind of health policy consultant group. And Elizabeth Stoltz, who many of you know, is my colleague and partner, and she is, I believe, on the call tonight too. So if you want to go ahead to the next slide, Carson, please. I am going to share some information with you tonight with respect to kind of choosing a healthcare plan, whether it be for on the marketplace on Covered California or whether it is with your employer. The kind of tips for choosing a health plan haven't really changed over time. What's changed is what's in the health plans, just kind of making these tips a little bit more important. So, first, let me say I recognize as a patient that, choosing a health plan can be difficult, can be time consuming, but it's really important because it impacts both your physical and your financial health for you and your family. And it's also important to note that as we've all been listening to the news for the last several months, there are many changes that are starting in 2026 to the healthcare landscape, due in part to the passage of the One Big Beautiful Bill Act. And so I just wanted to start by giving you just some what I call just 10 tips for choosing a health plan. And these are all just to help you prepare. As I said, doesn't matter what kind of plan you're choosing. This applies to everything, which is start early, especially this year. Don't procrastinate. I'm going to talk to you as we go through this about when your open enrollment time periods are. And I'm going to encourage you to go in as early as you can to make your choices this year. The reason being, due to some of the changes that are happening, there's going to be a lot of traffic on those enrollment websites. And I don't want to see anyone get stuck in a situation where they've waited till the last minute or until that last week, and you find that the websites are crashing. So start early, don't procrastinate. Make sure you have everything you need in front of you when you start your review. And, we'll talk a little bit about that. One of the first things that I say is to make sure you have, tip number 3 is have a copy of a personal health history guide for each member of your family. What that is that's going to give you information on who all your doctors are, what medications you take, how often you usually go to the doctor's office. We can usually judge that by what we did this past year. How many times do I go to the doctor? I go twice, once a year for my annual visit. I usually have one sick visit. Maybe I go for vaccines, those sorts of things so that you have an idea of how many times you go. So that's important. Um, some of the things that you're going to want to do when you're choosing a plan is you want to compare the costs for the plan. A lot of times we think about what our premiums are or what our copays are, but it's important to understand that your costs include your premiums, your deductibles, any copays, any coinsurance. So it's important that you are, when you're looking at a plan, that's one of the things you're looking at. What are all of the potential costs you have with that plan? Have a glossary of commonly used health coverage terms. I always say that health insurance companies are a lot like the government. They love acronyms. And so you see lots of those and you're trying to figure out exactly what they are. Make sure you have a general understanding of what those abbreviations mean. What I will tell you is that for the tips I have listed here as 3, 4, and 5, um, NORD, which is the National Organization of Rare Diseases, they have a website called claimyourcare.org. I know that the Bleeding Disorders Council of California is a member of NORD, but I would encourage you to go there because there's a template on there for a personal health history guide. You can either pull it up as a PDF and complete it, or you can do it in a Word document format. I encourage you to have that updated for you and everyone in your family. There's also a glossary of commonly used healthcare terms, and there will be a chart up there that will show you how to list all of the costs that appear in each health plan, and we'll tell you how to compare those. Make sure that you have a link. If you're with your employer, make sure you have a link to the health plan provider networks so that during your review, you can make sure your doctors are included in the networks that you're looking at the plans you're looking at. Make sure you're pulling up a copy of the plan's summary of benefits. This is something that tells you what all is covered under the plan, what is not covered. Typically, you'll also see what your copay is in the summary of benefits as well. Also, one of the things to search for is extra benefits. Some health plans on the marketplace have extra benefits that they offer. That may be something like a rewards program, where if you participate in certain activities that they post on the website, you can earn points. Sometimes those points will come to you on a gift card. You can either order, items through the rewards program site, or a lot of times that gift card can be used to pay utility bills or to pay some out-of-pocket costs. Um, Make sure you have a checklist that you can use to compare plans so that when you're looking at plans, you're looking at for the same thing in each one of the plans so that you're comparing apples to apples. And really take your time. Once you make a choice and you choose a plan and you enroll, you're often stuck in that plan for the next 12 months. That's important to remember. So you want to make sure you've really, taken a good long look at your plan's benefits. You're comparing, all of your options to each other, and you're kind of going back and double checking that before you click enroll. And the other thing is ask for help if you need it. I can tell you the folks at the Bleeding Disorder Council of California are incredible. They are very up to date on what's happening in the health plan market, and they are a great resource for you. Your hemophilia treatment center social workers are a great resource for you as well. And you can call the other national organizations as well for support if you have questions. So let's move on to the next slide. Okay, so first of all, we're going to start with Covered California and changes for 2026. I will say this about Covered California. I look at a lot of marketplace plans around the country, their websites. Some are state run, some are run by the federal government. Yours is obviously a state run program. Um, Covered California does an excellent job of putting up information in fact sheets about changes on their website. They'll have a section, What's New? And it's really important to go in and look at that. I know I was just reviewing it last week, and then over the weekend, they had noted that they were going to be making some changes over the weekend. I went in on Monday and they had a whole new updated list of information about changes that were going to be occurring. So I reached out to them by phone. I have to say it's the fastest I've ever gotten through to somebody on a marketplace. They do an excellent job in answering questions. The gentleman I spoke with, I probably spent 30 minutes on the phone with him, and he answered every question I had. So you are very lucky in that regard with your marketplace kind of staff. So I have this broken out into two different areas, and it can be a little confusing when you're looking at the website and you're trying to figure out when open enrollment begins. Covered California has two different um, time periods. They have first for current enrollees. Current enrollees, they are going to start renewing your plans beginning October 15th. Their goal would be that if you are already covered under a Covered California plan, that you will call them between October 15th and November 1st when open enrollment begins for new enrollees in Covered California. But if you currently have a plan, you should have probably already received information from both Covered California and your health plan that you have had this year, letting you know if your plan's going to be available, if the same plan you're on now is going to be available next year, um, or if it's not available, they may make a suggestion to you of something else that they think is comparable. So it is important, make sure you are opening any mail you're receiving from your health plan right now. This is their time to be getting information out to you. The other great thing that Covered California is doing that not all of the marketplace plans are doing this year is they are automatically re-enrolling you in the same plan you had in 2025 if it's available and if your eligibility hasn't changed. Now, what I'm going to say to you is even if your eligibility hasn't changed and you know that you're eligible for a marketplace plan, and you're happy with the plan that you're getting, so you're okay with re-enrollment, I would still call because one of the big things that is going to change in 2026 is as of right now, there will still be financial assistance available, but it's going to be at a lower amount than what it was in 2025. In 2021, Congress had passed a rule that allowed for increased levels of financial support, even up to people that had higher incomes. Some of them got support for the first time this past year, and unfortunately, unless Congress acts to change that by December 31st, unless they renew that, the amount of subsidies is going to be decreased for 2025. And the way that you will find out what your exact amount is going to be is by calling in during that time period, during that renewal time period, and they'll be able to help you with that. The other change is that you are going to need proof of income. If you're someone who's on a subsidy now and you believe you're eligible for a subsidy, even if you're not sure, make sure you have proof of income when you make the call for your plan renewal. What you can do with that is it can either be pay stubs, It could be your tax return from last year. If you think that that's going to be what your income looks like it's going to be again in 2026. But even just having a couple of your pay stubs um, will meet the requirement for proof of income. So then if you're a new enrollee open enrollment begins November 1st and it runs through January 31st. If you want for your plan to start at the beginning of the year, January 1, you have to enroll by the end of December. And I would not wait till the end of December. I would say to you that if you want it to be on January 1, I would try to make sure that I was applying by mid-December at the latest. Um, Again, I think one of the reasons that we worry about the amount of traffic to the website is because of the change um, in the financial ability, because of the changes that are happening to Medi-Cal. Some people may be losing their Medi-Cal and may need to now be going into the marketplace. So you're going to have a lot more people calling into the marketplace than what has before, or going in online to the marketplace. And some of you may or may not remember, I was around when the marketplace first opened, and I was in charge of policy at the National Bleeding Disorders Foundation. And I can tell you that first year, the marketplace website crashed consistently. So you want to make sure you're getting yourself in there early, getting your information in, and getting your plan chosen so that you don't end up inadvertently missing the deadline. If you go into January, you can still go to open enrollment for the month of January, but then your plan will not start till February 1. So for many of us, that means if we waited till then, we're going to have a month's gap in our insurance coverage. And obviously, we all know we don't want to have a month with no insurance and our hemophilia. So, and again, financial assistance will be available in 2026, but the amounts are lower than in 2025. And if this is your first time as an enrollee, your proof of income is going to be even more important. You need to make sure that you have that available to share with them when you are requesting the subsidies. Next slide, please. There are some other changes that are happening in 2026 that actually impact both new and existing enrollees. So financial help and pre-enrollment verification, it was beginning September 2025. The automatic 60-day extension to fix income inconsistencies is no longer going to be available. What that means is if you were someone who had submitted your application and you submitted an incorrect amount for your income, there used to be an automatic 60-day extension. Now there's like a 95-day, kind of a standard 95 days to resolve. But again, it's really good to try to get as close as possible to what your income is so that you don't find yourself in that situation where you're having to call back and try to make a change. Um, it does say that if you're going to need more time than 95 days to resolve your income inconsistencies, you can call Covered California and speak with a representative there and explain your situation. Also, previously for low income households, which are, defined as individuals who are making 22,590 or less a year, or families making $46,800 or less a year. There used to be a special enrollment period specifically for those individuals. That special enrollment period is gone. You will have to enroll during the regular open enrollment period that I just said, that I just talked about earlier, which is for new enrollees starting November 1st, for returning enrollees, it will be October 15th. There are other types of special enrollment, though, that still exist, whether it be you lose your job, so you lose your coverage, you get married or you get divorced, you have a child, or adopt a child. These are other what they call qualifying events. Those do qualify for special enrollment still. So I want you to know there are some special enrollments still in place, but this one, which was new and special for a certain time period, is no longer there. Next slide, please. The other changes, as of August 31st, those who fall under DACA, health and dental insurance eligibility was terminated by the federal government for DACA recipients through Covered California as of August 31st, 2025. Those individuals will also not be eligible for coverage in the marketplace in 2026. Now, if you're eligible if you're already eligible for Medi-Cal, you will still be able to be eligible for Medi-Cal. You just will not be eligible to go into the marketplace. Something else new, health savings accounts. In 2026, bronze and minimum coverage, which are also referred to as catastrophic plans, through Covered California will count as high deductible health plans, which means that that allows you to be able to contribute to a health savings account. In the past, because of the way they were created, those plans did not qualify, but they have been changed. And so they now meet the rules to be considered a high deductible health plan. Also, beginning this next year, HSA funds can be used to pay for direct primary care fees. That is like a monthly membership fee, sorry, not feel, a monthly membership fee that allows you to get a range of primary care services that you can use HSA funds for. And individuals can use up to $150 a month out of their HSA for primary care services, and families can use up to $300 per month out of their health savings account for direct primary care fees. Something else that is special to California is that gender affirming care, because it is covered under state rules, because they're state rules that protect against discrimination, health insurers in the state of California must continue to provide gender affirming care. That is not the case in many other states starting in 2026. So next slide, please. Then there was, we hear a lot in the news about changes to Medicaid, in your case, Medi-Cal, and the marketplaces due to the One Big Beautiful Bill. But we don't hear a lot about employer plans. And many of us do receive our coverage still through employer plans. And the bill actually impacts employer plans in what we consider kind of direct and indirect ways. One of the indirect impacts is that because of some of the cuts to Medicaid or Medi-Cal, tighter enrollment rules for the marketplace, reduced subsidies in the marketplace. There is an expectation that several people are going to lose the coverage that they had in 2025 because it may have been through Medi-Cal or through Covered California. Or it may also be that some employees chose not to get their coverage through their health insurance company because they were able to get it less expensively through Medi-Cal or through the marketplace. But now with those changes, it may be more affordable for them to switch back to an employer plan. So what the employers are expecting to see is more people coming onto their health insurance rolls, some of those people being sicker or higher cost than what they had on their plans in 2025. So some employers are starting to brace for that. So you may see that your premiums through your employer are a little bit higher in 2026, or that there may be, if it's a self-insured employer, there may be some benefits that they are not going to offer in 2026. So it's going to be really important to read your company's health plan very closely as well when you're making your decisions for next year. The other thing is that Medicaid now has some new work requirements. They even have some cost sharing provisions. Some Medicaid programs are requiring eligibility redeterminations every 6 months. Again, this is another reason that employers are concerned that people will be losing their coverage and coming back onto employer coverage. Um, you know, Either way, whether it's Marketplace or Medi-Cal, if someone loses coverage, or if, let's say, a lot of people just don't get coverage at all, it could increase premium costs for employer plans and for others in the marketplace. So if you want to go to the next slide. Then there's some direct enhancements to employer health benefits. Now, these are things that could be good for the employees um, and good for employers. One thing is there's a program called choice arrangements. These used to be called ICHRAs, which was kind of uh, optional ways for the employers to help their employees cover some of their health benefits. Well, this is a new way for them to do that. Number one, what it does, the choice arrangement actually allows employers to give workers tax-free money to buy their own health insurance. Um, Yet they can still also offer regular group insurance at the same time. A lot of employers would say, well, we offer group insurance, so we're not going to give you money to buy your own health insurance. Or others were saying, we're going to give you money to buy your own health insurance because we're not going to offer health insurance. In this case, this allows them to do both. That way, you're getting to choose which is the way that's more affordable for you to do that. Small businesses under 50 workers would get to give about $100 per worker each month as tax-free money in the first year, and about $50 per worker each month in the second year. This program could start as early as 2026, but some employers may not start it right away. But it is good to look at your plan and see what kind of options you have. The goal of these choice arrangements was to kind of help make health insurance more personal, flexible, and portable. So, it's hard for an employer to get a health plan that works for every one of the employees. If there's a way that, if their plan doesn't work for you, but they can give you some tax-free money to buy your own health insurance, it makes it easier for you maybe to go into a marketplace and see if you can find a plan that is more suitable for you and meets the coverage needs you and your family have. So next slide. Um, Also, we talked about the health savings accounts being available in connection with the bronze plans and the catastrophic plans, but there's also going to be some expanded opportunities within health savings accounts that you may see through your employers. The new rules are intended to make HSAs easier to use and more useful. So, for example, telehealth visits can count before you meet your deductible, which means you can you can use that money before you've met your deductible. HSA money can pay for direct primary care, which is your monthly doctor fees, can pay for gym memberships or other wellness costs. You'll want to look at your plan. If your company is offering some sort of wellness program, they will be pretty specific about what those services are. So you'll know what those wellness costs are that you can apply your HSA money to. Again, the intent of this is to give more flexibility for both workers and employers. Next slide. One of the other benefit improvements, I don't know how many of you have a employer plan that offers an FSA, which is a flexible spending account. This next year, the limit that you can put into your flexible spending account increases from 5,000 to 7,500 in 2026. This allows you to put money into this account pre-tax and be able to use that to help pay for some of your healthcare out-of-pocket costs. Some of those programs also that are available that are increasing will help you pay for childcare as well. Again, pre-tax. Paid family and medical leave. There's a tax credit that's now permanent for employers. So hopefully this leads to easier rules for more families to qualify. Telehealth coverage. Employers can offer telehealth with no cost to workers without it affecting their HSA eligibility. So they could do that where there is a zero copay for their workers to use telehealth. And I will say to you, one thing I learned this year, I'm someone who is on a marketplace plan, and I did not realize that, I realized that they covered telehealth visits with my clinicians, but I was traveling and found out that they did have a option for telehealth when I was not in my home state. Or when my doctors were not available, they could get me to a telehealth professional. And that was done directly through my marketplace plan. And it was very efficient and very easy to use, and it was provided to me at no cost. So again, those are things for you to look at when you're looking at your options in the marketplace or in Covered California plans. So next slide. And I think we have to remember why it's important to keep up with the health coverage changes. First of all, you don't want to lose coverage. Rules can change. It's important that you know when those changes happen so that you can stay insured. What I always say is health plans are allowed to make changes to their plans. All they have to do is be able to show that they sent out notifications to you. They can't make you read them. So I go over this all the time. It is really, really important that you open everything that comes from your health plan. I preach this at home too, and I will tell you, I was just going through some of my son's mail, and found out because he had a stack of it at his house that he hadn't opened. And I opened it and I came out holding something for him. And I said, remember how I always say open everything that comes from your insurance company? He said, yes. Why? I said, because I'm holding a check in the amount of $500 to you because your plan had overcharged, had charged too much for premiums, and they're issuing you a refund. And it had been sitting in his mail for 6 months. So I'm just saying there's lots of good reasons to open your information from your health plan, as well as reasons that make us nervous. So the other thing is to save money. New programs that they have may help lower your costs. Like I said, I was ready to go to a urgent care center out of state where I probably would have had a much higher copay, but I got online and I realized that I had this telehealth option, and I got seen, talked to a doctor within about 45 minutes, and had a prescription called in within 10 minutes later and had zero cost to me. So it is important for that. Also, it's that there may be more care you can get. like the added benefits for telehealth. And the biggest one is a lot of the wellness programs. The fact that you may get to be able to have rewards, like I said to you, where you can use those to pay your utility bills, or you can get a free gym membership for you and your family. There may be certain screenings, extra screenings that come that are at no charge to you. So, staying abreast of the changes may allow you to get more preventative care. It also allows you to be ready, to let you know what's coming as you plan ahead. Like I said, me being able to say to you, hey, this year you're going to have to show proof of income. It used to be that when you were applying for a marketplace plan, you would just say what you expected your income to be, and they would base your subsidy on that. And then theoretically, at the end of the year, when you paid your taxes, if you made more than you thought, they might take some of your refund, or they might tell you you owe something back. Or if you didn't take, or if you overestimated your income, you might find that you get some refund back. In this case, you have to do that up front. And again, this just protects your family. It saves you money, by making sure that everybody stays covered. Um, Use all of the benefits that are available to you. There's another benefit that I know as a chronic disease patient. I always used to get a call from my insurance company saying, we offer a disease management program that we would like to offer to you free of charge. And the old disease management programs really was like, it seemed like it was always a nurse that wanted to explain to you about, let me tell you how to use your factor. Let me tell you how to, why it's important to go for a comp visit. I was like, I know all of that. I don't need you to tell me that. Actually, now, a lot of times you may get a call where they say, would you like to be, we have a care management program available free of charge. Would you like to hear more about it? I'm going to encourage you to hear more about that. What that is sometimes is wraparound services. That is where they will give you a case manager that may help you coordinate appointments that you have. They may help you find a particular type of provider. They may help you with, if there are forms that need to be filled out. It's really important that you find out what these services are, because they can, especially one of the things I always think of that's very difficult is sometimes getting durable medical equipment. I need a wheelchair. I need crutches. Sometimes that's very difficult. If you have a case manager, they can help you get through that process. So please think about that in there. And then, you may have more choices. Staying informed is going to give you more options. You're going to know that, hey, you know what? According to this, some health plans have case management programs, but not all. I want to look for some of those, you know? So again, just make sure you're opening everything that comes in, because I don't want you to miss anything. I don't want you to miss a check. I don't want you to miss a deadline. And I certainly don't want you to miss an opportunity to get more benefits, or to get someone to help you coordinate your benefits in a way that makes the whole insurance process less stressful. I see a question in here. How does one submit proof of income when re-enrolling? Do we have to scan the tax return and submit to Covered California? I did not see that on there yet. That I'm sure is something that they will tell you. There probably will be some way that you have to submit it to them. It may just be that you can upload it by scanning it. It may be that you can send something, sometimes I'll give you a QR code that you can pull something up on your phone, take a picture, send it in. When I spoke with the gentleman, he was not able to tell me that just yet. I think in reality that a lot of people a lot of these health plans are really kind of, and Medicaid programs are sitting back really hoping that there are some additional changes before the end of the year that Congress acts and, for example, increases premium subsidies. But I will say, for those of you who are re-enrolling, it's coming up on October 15th, is not that far away. I would just make sure I had copies of them. And I would go in and look online on Covered California, look at what's new. I believe there's also a place where you can, type in a question. And if there's an answer, they'll give you an answer. If not, they give you a number where you can call Covered California. And like I said, fastest I have ever gotten into a marketplace when I've tried to call to ask questions. And I found the gentleman who answered the phone to be incredibly informed about what was happening with Covered California. So, next slide. The other thing that you all have is California's Genetically Handicapped Persons Program, which is another form of healthcare coverage in California. For those of you who don't know, GHPP provides healthcare services for adults with genetic diseases such as hemophilia and other genetic conditions, and it helps people who qualify with their covering their healthcare needs. You can have GHPP even if you have other insurance. So you could have Medi-Cal, you could have Covered California, you could have TRICARE, you could even have private insurance through your employer. GHPP will just act as your secondary cover. There is an annual enrollment fee to get into GHPP, which is calculated on your adjusted gross income, at 200 to 299% of federal poverty levels. Your fee is 1.5% of your adjusted gross income. At 300% and above, it will be 3%. If you qualify for Medi-Cal, there's no fee. But what GHPP would like everyone to know is apply now. If you only have one coverage, or you don't have coverage, or you're afraid you're going to lose the coverage you have, please don't wait until the end of the year. They're accepting enrollments now. There is a link up here where you can go, where there's an application and instructions available on the DHCS website. But also there is a video on more about GHPP and tips for applying on the council's website. So I would encourage you to go and look at those and definitely take advantage of this. Now, obviously, if you already have coverage and you're just not sure, yes, there is the fee that it depends on what that amount is. But again, I just encourage everyone to make sure they get their enrollments done as soon as possible, because we are not the only ones telling our communities to go and apply and to do so early. So you just want to make sure that you don't get caught in a situation where there's so much traffic to these websites that they crash. I believe that may be my last slide, Carson, but yep. So it's just for questions now. So if anybody has any questions, I'm happy to help what I can. And I'm sure what I can't, Lynn and her team can.
We can certainly try. And also for folks who are interested in GHPP, we did put some links to both to the website where you can look at applications and things like that. And also the Bleeding Disorders Council did actually make a video about GHPP specifically. So you're also welcome to look at that. But I know that we did have some questions in the chat, so maybe we can just run through some of those fast. Some of them we might have answered just throughout the course of the presentation. But maybe we'll just start from the top here. Somebody had said they have not yet received anything from Covered California. Sounds like in the mail or email, and then was just checking to see if other folks in the chat had seen those information. I can say I have not personally received anything from Covered California. But Michelle, I don't know if you are aware of the timeline when they would be sending things out if folks haven't received anything yet.
Well, I know that some people have. I've
Mhm.
seen one of the letters at least that has come out from Covered California. Um, so I would have expected them to be, you know, already out. Um, they put up quite a bit of information over the weekend in comparison to what they had like the week before.
Mhm.
Um, And so it might be that they were waiting for that. What I will say to you is I asked the question too about if the enrollee period, if the current enrollee period starts October 15th, when does it end?
Hmm.
Theoretically, it doesn't end until open enrollment in general ends, which would be January 31st. But what I would say to you is their hope was because they want to be able to get you set up so you don't have to worry. They would like to have people coming in between October 15th and November 1st. Because remember, there's a good chance that there's going to be a lot more people coming in November 1st than what there was last year because of the Medi-Cal changes. So he said, I asked that question too. And he said, they can do it, but the thing is you're going to end up in queue with everybody else, right? So, you know, it may mean your wait time is longer.
Hmm. Absolutely. Okay. And then I know folks have also put the phone number, the sort of 1-800 number for Covered California in the chat. So if you're not able to find information on their website and you need a quick response, you can always give the folks over at Covered California a call. But like Michelle said, the sooner the better, because eventually they're going to be quite backed up and it might be a little bit harder to get a hold of them in November than it is right now. But okay.
I do see a question that says, my son has GHPP. He's not had income for a few years and is now starting his own business. How will he prove that he has had no income until now? Um, I'm assuming because he had no income, he was not filing taxes. If that is correct, one of the things you can do is you can go into irs.gov, you create a account for yourself, and you can request something that shows that you didn't have in that there was no federal taxes filed or no taxes filed for those years before. I know I've had to do that for other people here in Indiana when they've needed something, and I had to show proof of income. And I said, well, they didn't have income last year, and they said, well, then show us that they did not file taxes. And there is a form you can request on there, and it'll say no tax transcript received. And so that is one way you can show that there's no that there was no income.
Hmm.
Beyond that, I would just ask them at GHPP how to do that. But I think, they get that to you relatively quickly when you request that form.
Hmm. Okay. All right. Does anybody else have questions? You're welcome to just put them in the chat or raise your hand. Thank you. Well, with that, I guess I will close this out by saying another big thank you to everybody that made this presentation possible tonight. Also remind everybody that we will have a recording available on our YouTube shortly. So if you want to come back to this later, you are welcome to do so and use this as a reference. I just want to thank all of our sponsors on the screen tonight for helping put this on, for helping provide translation services. A huge thank you to Michelle for providing your time and your expertise tonight. We very much appreciate it. Would not be here without you. Um, and with that, we've got our social media here if you want to keep in touch with what the Bleeding Disorders Council is doing, or if you have questions about your insurance as you're going through, whether you're re-enrolling, you're changing your plan, or what have you. We've got our contact information here. We've got our contact info for our executive director, Lynn, who is an absolutely fantastic resource. I'd highly encourage you to reach out to her, go to our website, or check our social media just to um, keep on top of all of the resources that we are putting out. But with that, everybody have,
Carson, can I
of
just
course.
remind everybody too, again, the Bleeding Disorder Council is part of NORD, and I would encourage you to go to claimyourcare.org. There's also a lot of information on there about how to file appeals, There's information on the different types of health plans that you can have. And then there's also some informative fact sheets on just various healthcare basics. So please visit the site.
Absolutely. Yeah, I know, especially when folks are being denied care, it can be a very stressful process, and you want that to be relieved as quickly as possible. So I've definitely taken a look at some of those resources. If you want something to make that process of appealing a denial of coverage for anything, please go to claimyourcare.org. Just put it in the chat again. But yes, absolutely wonderful resource. Okay.
Thank you, everyone.
All right. Thank you so much, everybody. Have a wonderful night.
Bye bye.